Hair loss is normal in every patient because as we're growing up, our hair tends to be shedding. But alopecia is when we share more than the 15% that's normally that it's sloughing off our hair follicles. So alopecia, when we have a lot of hair loss, it can be noted in our scalp. Women and men tend to differ in which parts of the hair is lost, and that can be detrimental to the looks of the patients. The different types of alopecia is normally androgenic. Men and women suffer the same. 50% of men and 50% of women after the age of 30 to 60 will suffer from this problem. An uncontrolled hair loss. Normally we are producing hairs. 80% of our scalp is producing hair, and the other percent are stagnated or are sloughing. But when that percentage increases, then we can see our hair that it's not there when we had it and as we were young. And also the hair can be thinning, and that can produce hair loss. And the different types are androgenic, that means that is hormonal. Sometimes it's immune, like in areata, where our immune status is our own immune system is fighting the hair, and that can cause some patches in our scalp or scarring. So our hair is being lost due to scarring, and that's more difficult. But it can be treated. Well, there's a lot of over-the-counter treatments that normally patients get for like shampoos or remedies, some medications. But we have to check what are the main causes of that hair loss or alopecia. Normally the options are transplantation that many people seek, but there are new treatments like regenerative medicine that we can use PRP also with stem cells or exosomes that give information and to grow the hair and also produce more vascularity, more blood flow to the hair in order for it to grow. Well, regenerative medicine is cellular therapy. So we use PRP, we use stem cells, and we use different types of treatments or integrative treatments to grow the hair. And we try to do minimum invasive procedures. What does it mean? That we use low-level laser therapy to stimulate the growth. We use PRP, we use IV therapies, we use stem cells and exosomes in order to get the blood flow that we need, the information for the follicle to grow, and also the elements or genetic elements that needs, the growth factors that needs for the hair to grow and to in length and in size. Thank you. For stem cells or exosomes are specialized cells that have growth factors, androgenic factors. That means factors that need the hair follicle or the hair in order to grow. And they are very safe to use. We use it normally with PRP, and we inject it to the scalp in order for the hair to grow. Well, regenerative therapy is minimum invasive. So we have minimum invasive procedures, and we use PRP, low-level lasers, and cellular therapy like exosomes and stem cells. So as a difference with transplantation of hair follicles, well, the patient comes, gets the treatment on the scalp, doesn't really bother much the patient, and it can even go to work in the same day because it's a 1-hour procedure. So it's beneficial in the sense that it's more rapid, minimum invasive, and it hasn't have a lot of side effects. As we use injections to the scalp, that can cause a bit of pain, swelling, and if you don't take care of your scalp in the 24 or 48-hour period, you can have an infection. But as we give information to our patients not to get the swimming pools or not to do anything that can damage the site that we injected for any infection, and we haven't had any real big problems. If you have hair loss, alopecia, and you're thinking of transplantation, that can be another option like regenerative therapy. Because if you have the probability of getting your hair back as a natural way, then you're a very suitable candidate, because you lost your hair and you wanted to regrow back, and you know that you have the possibilities because you don't have you recently had the problem, or you have a lot of time, but you know there's the hair follicles there. So if the hair follicles are there, we can regrow them back, and then you're a suitable candidate. We use low-level laser therapy for alopecia, and we normally use it before we put the treatment on the scalp. Why is this? Because we need the lasers to get the proliferation of the hair follicle, the hair, starting, because the energy that needs to grow the hair is there with low-level laser therapy. Actually goes to the mitochondria, starts the mitochondria reacting. Then we use IV therapies, and then we put the injections on the scalps needed with exosomes, PRP, or stem cells in order for the hair follicle to grow. And then after the treatment, we use it again in order for the hair to really get the energy and the growth factors into the hair follicle in order to start growing, not only in length but also in size. Well, with the first session that we give with laser and all the treatment is what you need, and the hair slowly is going to be growing, not only in length and in size. So if we put more laser or we put more session, the hair has a time to grow in length, in size. We're trying to get the faster, but nature has its course. So it takes about 8 weeks to see how much hair grew and how thick it did. So it's what you had before. You lost your hair is what's going to be growing. If you put more laser sessions, you can do that. It's safe, but it's not going to really give you more length and size and more hair. In in the normal type scenario. It's only when you have specialized diseases that we can use more lasers, like in areata, or something that we have to give more sessions because you have other types of diseases that have inflammation. That's when you need more laser. But if you have a normal oily scare or a scalp or a thin scalp, or you have any other diseases that it's normal for hair loss, then with only one session that we give it twice, before the session and after the session of the treatment of the scalp, is more than enough. Well, laser are right for every person because it's like a key to open this inflammation that we need for any disease, including alopecia. It's very safe because it talks to the cell, especially the energy part of the mitochondria, and that really helps us to, with any medication and any treatment, to really address diseases as hair loss. So, and it's very safe because it's minimal invasive. It doesn't have high power that can cause any damage to the tissue or burning. So that is really good for the patient because you can not really feel any side effect, and helps a lot with vascularity, inflammation, and stimulation of, in this case, hair growth. There's the normal, if you're pregnant, that can be, that is not really a contraindication, but we have to be wary of any problems. And if you have tattoos, they have lead, because the accumulation of energy in the lead can give you burning. So that can be a problem. So tattoos on the scalp would be a contraindication for laser therapy. Nutrition is very important for any person, including the hair. If we lack of biotin, vitamin D, selenium, copper, all those are needing supplements for the hair maintenance, production, color, and so it's very important. And also the stability of the hair. Vitamin D works as an hormone, so it's very important in other parts of our body, including our immune status. So if you have problems with your immunity, that can cause problems in the hair. If you have problems with the supplementation that is needed for the production of the hair and in the color, so the nutrition is very important. That's why we give supplements. Sometimes our food is not rich in nutrients, so that's what we give supplementation. And good supplementation is very important. Not all the supplementation are good. Not all the vitamin E are organic. It won't cause you problems, but the ones that we recommend are very organic, very safe. You can take it daily, and it will help not only your hair but other parts of your body, including your nails and other parts that are needed, even the skin. Hair loss is normal. If you have more hair loss and it's causing you alopecia, well, you have to check your nutrients, what you're eating. Chemicals are very bad. If you have high sodium intake and low potassium, that's bad. If you have deficiency in any part of your nutrition, that's not good. If you have problems on your scalp, you have oily scalp, or you have a dry scalp, if you see thinning in your hair, well, you have to check, because sometimes it needs vitamins, and they're good shampoos and supplements that you can take for the hair loss, and not put many chemicals in your hair is very important. So sprays normally have a lot of chemicals and alcohol, and that can cause dryness. And also because you're aging, your scalp is getting thicker, and so the chemicals and also the dryness, that can cause constriction of the hair and can be lost. So anything that you can do to get your scalp and your hair more younger, that will help it a lot. So that involves some shampoos, some nutrition, and some things that you have to put in your hair that will be right in each case for you. Well, the results are obviously the growing of the hair. How much hair? Well, it depends on your scalp, your problem, how much you help us to treat with your the medications or supplements that we're giving you, and you can see the hair growing slowly. It grows about 1 centimeter for a month, but sometimes the thinning of the hair is what gets you anxious, because the size of the hair has to take another month or so in order to grow. So you will see the complete results in about 8 weeks to 12 weeks, when you can address how much hair and how much the size of this hair has grown. It takes a month to see how much hair has grown, about 8 weeks to see how much is grown and how thick it's getting, and in about 3 months then you can see the complete results of the treatment. And basically that's the timeline. But you have to take care of the hair, as we explain it, with the shampoos and the supplements and all that we give you in order for the hair to grow. Even some hormones that we have to take care, and we can address that. So it takes about 12 weeks in order for you to see the results. That it's different, because sometimes when in transplantation you have to wait about 6 months to see the complete results. So I think it is faster, safer, and it's minimally invasive.